back rehabilitation, lumbar spine stabilization exercises. This is how to avoid surgery, and even after you've had surgery, how to decrease pain and increase your function for the rest of your life. So it consists of two basic things. You want to decrease tension in the muscles and then build strength and endurance. So the main core part is building the strength and endurance, and that's in our app, the Back Doctor app, which is free in the Google Play Store and the App Store. The whole program's in there. So I'm going to talk about those two components. First is the decreasing tension in the muscles. So what happens is when the muscles are constantly contracting, constantly firing, they lose oxygenation. So then they undergo anaerobic metabolism. It's the same thing that happens to runners when you run a lot and the muscles don't get enough blood and oxygen. They undergo anaerobic metabolism. That's why it burns. Why does it burn? Because the anaerobic metabolism, your body needs to make ATP, and so it does it through the Krebs cycle without oxygen. And the byproduct of that chemical process, if you remember from chemistry, is lactic acid. Lactic acid causes the burn. It is a pain mediator. So the point of that is if you have constant muscle contraction, it will generate lactic acid, which is a pain mediator. What causes chronic muscle contraction? One is pain. If you have pain from a disc being degenerated or nerve pain or facet pain, the muscles can get tight, constantly be firing to try and take some stress off the spine and decrease the pain. But unfortunately, because the muscles are chronically firing, that anaerobic metabolism will cause lactic acid, which will cause more pain. It's a pain generator. The other part is if you're holding mental or emotional, psychological stress and tension in your muscles in your back, that can be a source of back pain. That's one of the reasons why sometimes people's MRIs look normal and all their studies look normal, but they have severe debilitating back pain. It may be because they're holding stress and tension in the muscles, causing chronic firing in the muscles, the lactic acid, which is a pain mediator. So the tension is due to pain and also causes pain. Therefore, what's the number one treatment to treat back pain? It's actually cardiovascular exercise. It's not losing weight, and it's not actually doing core exercises. The one that's been proven to be the most effective is cardiovascular exercise. Just working out and running and getting your heart rate up and breaking a sweat. Well, why is that? Well, one of the main reasons why may be because when you exercise cardiovascularly, where you're getting your heart rate up and circulating your blood, you can wash out the lactic acid that has built up in the muscles and oxygenate the muscles, and therefore decrease some of the lactic acid pain and relax the muscles. The other component is when you exercise with cardiovascular exercise, you can release endorphins, which are positive mediators in your system. So there's kind of this chemical war going on in your body between the positive mediators and the negative mediators. Lactic acid is a negative one. Endorphins are a positive one. So if you do cardiovascular exercise, you can help tilt that balance in your favor to have more positive mediators and decrease the pain. The key to cardiovascular exercise, number one, is it can't produce pain. So I have some people say, I'm a runner, I gotta run, that's what I do, but it hurts my back every time I run. Well, then you're not a runner anymore. You gotta diversify, you gotta get creative, you gotta be flexible, you gotta be committed to getting some exercise. You don't care how you get it. If you can break a sweat, that's the goal. So do an elliptical, do a bike, swim, get in the pool, do water aerobics, do Tai Chi on a YouTube video, do whatever it takes to get some exercise, breathe, get your heart rate up, circulate your blood, wash out that lactic acid and release endorphins. That'll treat your back pain. It's been proven better than anything else. So you want to diversify your aerobic exercise. I only let myself do 2 times a week of running. I force myself to do other things other days of the week. So you want to diversify. You don't want to do anything that provokes pain. So that's the exercise. Other ways to decrease the tension in the muscles is to meditate and find some form of relaxation, hypnotherapy. There's downloads you can listen to. Take 15 to 30 minutes a day, lay in a comfortable spot and take a break. Just let everything go. Let the mental and physical tension leave your body and leave the muscles, even for a second. You know when you drift off and lose consciousness for a second, you don't know how long you've been asleep for? That's what you want. You just want to break some of that cycle, some of that tension just for a second. Get a massage. A third way is get a massage. Have a physical person or a machine or the thumper, the Theragun, all that type of stuff can work to break up some of the muscle tension that's built up. Ideally, every human being should get a massage once a week for an hour and a half to break up all the tension that's built up over the week. If that's too expensive, then find other ways to get it done. You can take 2 tennis balls and a sock, tie them together in a sock, and roll on that on the ground. Just do something where you're committed to yourself to break up some of that muscle tightness. A fourth way is diet. Now, diet varies with each person. You know, these anti-inflammatory diets may or may not help. You got to try it to see if it helps with you. So what are some of the inflammatory mediators that may be in your diet? Well, gluten, dairy, alcohol. For me, I really think of any processed carbs as well. Anytime you look at a package and it's got 1,000 ingredients on it and it can stay on the shelf for a year, what is all those synthetic products in there? They're probably not natural. Your body has to process them in some way, and it may react to them negatively, which can cause inflammation. So basically an organic, healthy diet, fruits and vegetables, makes the most sense to me. And it may help with your pain. Plus, it can keep your weight down so you don't have to work out twice as hard to keep your weight down. The biggest thing I've learned is I'm pushing 50 pretty soon, is that when you turn 40 years old, you can't work out hard enough to lose weight or to keep your weight down because you'll hurt yourself. You'll get tendonitis, ankle sprains, hurt your back, all sorts of things. How are you going to control your weight? It's your diet, period. Stop eating bad carbs is the bottom line. Eat the diet we all know we're supposed to eat. And it may help with the inflammatory mediators and decrease your pain. Other modalities and different treatments such as acupuncture, chiropractor, injections, decompressive machine, laser treatments, I feel pretty similarly about all of those. They can all help temporarily to break some of the muscle tension and inflammation and tightness to give your body a break, so therefore you can do the core stabilization exercises. So none of them have been proven to work specifically for different conditions. They all can help temporarily though, and a lot of them are user dependent. They depend on the practitioner who's doing it for you, and it depends on the person and their condition. So try them. They usually don't hurt. If you can afford them, try it, see if it helps break some of the cycle. So all of those things we just talked about are how to decrease the tension in the muscles and break some of the tightness and decrease the lactic acid that builds up. Then the second component of the non-operative rehab program for the back is to build the muscle strength. We can't stop the aging, the wear and tear of the disc and the joints. There's nothing to stop that. There's no stem cell injections, biologic, HGH. There's nothing to take, the glucosamine sulfate. There's nothing that has been proven to stop aging at this point. You know, that's the fountain of youth. Well, we're getting there, but we're not there yet. So what can we do? The spine is degenerating, but all we can do is work on the muscles, get the muscles strong to take some stress off the spine, decrease some of the micro motion that is occurring through the painful disc and painful joints. And our program in our Back Doctor app is a quantitative program of 7 different exercises. They're all basic exercises. Any physical therapist or certified athletic trainer knows these exercises: dead bug, quadruped, prone, partial sit-up. The key to our program is it's quantitative. You start at level 1, 5 is the max. Based on how strong your core is as you go through the program, that's how we clear people to go back to activities, and especially athletes. That's how we know when can they throw 50 feet, when can they start to shoot, when can they start to lift weights. Well, it depends on what level they're doing of the program. So you start at level 1. Level 1 is teaching your muscles to find a neutral, pain-free position and keep your spine locked in that position. Because a lot of people, if you have a bad back, you can't go do sit-ups. That hurts your back. So you got to find this neutral position that doesn't cause pain. And that's where a physical therapist or good athletic trainer can teach you how to find, or chiropractor, can teach you how to find this position, and then move your arms and legs and breathe normally, move all your extremities in balance and coordination while you're keeping your spine locked in a pain-free position so you don't aggravate things. That's level 1. Level 2, once you get to level 2, then you can do non-impact cardio typically. And this is our post-operative recovery as well, or after an acute injury. When can I start to ride an elliptical and do a recumbent bike? Well, you got to get to level 2. And usually we say you should be there of 3 of the exercises. If you're at a level 2, of 3 of the exercises, that counts as basically being able to do those activities that correlate with that level. Level 2 is non-impact cardio. Level 3 is more running, more axial loading, more impact. And for athletes, they can generally start to do more sport-specific exercises and routines that they do with their training staff. And they can also start to shoot and skate and run and throw and swing a bat and those types of things. Level 4 is really tough. Level 4 is where we want professional athletes to be before they go back and practice with their team or start to really lift weights. And then level 5 is where we want pro athletes to be before they go back to their sport. So the goal for most people is to get to level 3, which is really tough exercises. If you're at level 3, your core is stronger than 90% of humans. And as long as you're not having pain, we generally will clear people to go back to activities. But obviously, the better you get, the higher you get, the better. The stronger your muscles will be, the less stress on your spine, the less likely you're going to re-aggravate this injury. So please check out our app. It's free. It's got everything on there. It's got a second component on it. It's got all the back exercises. It's also got a meditation download on there. It's got recommendations for diet and exercise and caffeine on there. It's the Back Doctor app in the Google Play Store and the App Store. And your other option is please reach out to us. Please email us at info@watkinsspine.com if we can help. Thank you.